Good morning, good afternoon, and good evening, everyone. I am Maya Prasad. I'm a pediatric oncologist from India, and I am co-chair of the SIOP Survivorship Network. It is my honor and pleasure to welcome all of you to the webinar, which is being jointly hosted by the Childhood Cancer International and SIOP. The title of this webinar is A New Chapter, Adapting, Connecting, and Moving Forward. And I'm glad to see that so many of you have joined online. Before we start, I just wanted to announce a few housekeeping rules. Firstly, we will have simultaneous translation to Spanish. You can use the translation feature by clicking on the globe icon, which is there at the bottom of the bottom of the Zoom panel. And to enable the translation, you can select your speaking language and select your caption language as well. So midway through the webinar, we'll also do 2 poll questions and ask you to participate. So that would include survivors and or their parents. And at any time during the webinar, if you have any questions, please put your questions in the Q&A box that's there, and we'll take those questions towards the when it's time for the Q&A session. So I think we can start the webinar now. We will first start with some opening remarks from Rodney Wong. Rodney Wong, as you may all know, is the parent of a cancer survivor, and he is the president of the Childhood Cancer International. He is also the current president of the Sarawak Cancer Children's Society and has co-founded the Childhood Cancer Malaysia and is currently appointed as their honorary advisor. Rodney's opening remarks are being played in the form of a video.
Dear survivors, families, friends, and colleagues, it is a true honor to welcome all of you to this very special webinar, jointly organized by the Childhood Cancer International (CERNET) and the SIOP Survivorship Network. Now, as the president of CCI, and more personally, as the parent of a childhood cancer survivor, this moment holds deep meaning for me. Survivorship is not only just the next chapter after treatment. It is a lifelong journey filled with hope, complexity, and also strength. That's why today we come together not just to listen and learn, but to connect, to build something lasting, something powerful. At the heart of this webinar is a vision, a global network of survivors. In CCI, we call it CERNET, the Survivor Network of Childhood Cancer International. And it's not just an initiative, it is a lifeline. For survivors around the world, CERNET offers what medical care alone cannot: the power of shared experience, a place to be heard, to be seen, and to belong. When survivors join CERNET, they join a global family, a community where they can share challenges, celebrate victories, find support for lagged effects, and advocate for the unique needs of those who have lived through childhood cancer. As a parent, I know how important that community is. My own child's survivorship journey has shown me how critical it is to connect with others who truly understand. And when those connections stretch across countries and cultures, we don't just support each other. We change systems, we influence research, we guide better care, and we bring survivorship out of the shadow. Today's webinar is the perfect example of the power of partnership. I want to warmly thank the steering committee of CERNET and of SIOP Survivorship Network for organizing this event and for their tireless work behind the scenes. Your collaboration is not only inspiring, it is essential. Also, the partnership between CCI and SIOP continue to grow stronger, united by a shared mission to ensure the survivors of childhood cancer not only live, but live with dignity, with good health, and with hope. To every survivor with us today, your voice matters, your story matters, and together, through CERNET and SIOP Survivorship Network, we are building a global force for change. Thank you for being here. Thank you for believing in the power of connection. And thank you for walking this path with us. Let's keep building the survivor network together.
That was a very wonderful message, and thank you very much to Rodney for this message. I will next introduce my dear friend and colleague Nurdan. Professor Dr. Nurdan Taxlidis is the co-chair of the SIOP Survivorship Network. She is a pediatric oncologist and chair of the Pediatric Oncology Department of Ankara University Medical School. Dr. Nurdan is the former president of the Turkish Pediatric Oncology Group and currently leads the TPOG Survivorship Program. Nurdan will briefly introduce the SIOP Survivorship Network. Over to you.
You're muted, Nurdan.
You're muted, Nurdan.
Thank you, Maya, for presentation, and dear CCI and SIOP Survivorship Network members and dear attendees. I am going to introduce the SIOP Survivorship Network to you today. As you know, it has been established by the end of the last year. And these are my steering committee, group members, friends. We are working together. You know Sydney from the CCI already, and David from USA as a pediatric oncologist, Maria from Sweden as a research nurse, and Maria Ott and Katrin Scheinemann, a pediatric oncologist from the Switzerland, and Katrin will be our speaker today. And dear Maya Prasad is my co-chair for the SIOP Survivorship Network. And we have some aims to share with you. I'm sure we will be making it real, coming together. First one is promoting global awareness on survivorship after childhood cancer and providing easy access to information about long-term follow-up guidelines, which is good for all countries across all research settings, including low-income countries and middle-income countries, and providing mentorship in establishing and expanding survivorship clinic who are interested, SIOP members and SIOP members and their clinics, conducting webinars and other educational initiatives on the practical aspects of establishing, expanding survivorship care. So far, we have done 2 webinars already as a SIOP survivorship network, and then we have collaborated with the SIOP Global Health Work and Health Network, Psychosocial Wellbeing Working Group, which held last week. And then we had another education initiative, which it was a video recording by IPA, International Pediatric Association, to give some knowledge about how they can do the practice in their clinics as a pediatrician for the survivorship care. And then other aim is fostering a global survivorship research across all research settings. Again, our third webinar will be held by the end of the August at 27 August, which will be focusing on first speaker, especially global survivorship research, how to choose a item and how to make it possible. Another aim is collaborating with international groups involved in survivorship care and research, as well as related groups with SIOP network and working groups. I think this is one of the best examples we are doing today with CCI. And then we already sent the invitation letters to the SIOP Africa, SIOP South America, and SIOP Asia. Already we have joined the webinar by the SIOP Africa, and then we will send them another invitation for meeting. And we had our first meeting with the SIOP South America, and then we will do it again in near future with the more of friends from that location. And then another invitation will go back again to the SIOP Asia. Very important, another aim is increasing the representation of survivorship research in the SIOP annual congresses and eventually developing a survivorship track. And hopefully we will do it at 2026 in San Antonio. And this year, we will have a track with CCI. They provided us. We are thankful for that. We will be there working together and hope to see you all at the SIOP Amsterdam. Thank you all.
Thank you, Nurdan. Thank you very much. Next up, we have Patrick. Patrick Yip is from Hong Kong. I'm sure many of you know him. He is a survivor of osteosarcoma. Professionally, Patrick is a human resources consultant and he specializes in compensation and benefits in the Asia-Pacific region. Outside of work, as you know, he is dedicated to supporting the empowerment of childhood cancer survivors and advocating for a better quality of life for them. He is currently a member of CERNET. CERNET is the CCI Global Survivors Network, and he is also a core member involved in developing a regional survivors network in CCI Asia. So Patrick will briefly introduce the CCI Global Survivors Network, or CERNET. Over to you, Patrick.
Thank you, Maya, for the kind introduction. So hello, everyone. It is absolutely my honor and pleasure to represent the Global Survivors Network of CCI CERNET to walk you through some of the key objectives and recent updates of what we have been doing. So CERNET is actually initiated by survivor representative during one of the previous international conferences. And then that has become a strategic project approved by CCI board. So CERNET actually aims at connecting child cancer survivors around the world for multiple purposes. First of all, we hope to facilitate exchange of resources and information among survivors. And beyond that, we also want to have the influences in front of parents, patients, as well as healthcare professionals, not to mention the pediatric oncologist and the nursing team. Next, we also would like to raise awareness about child cancer survivorship together with SIOP Survivorship Network, and we hope to advocate for an equitable healthcare system around the world. Then we also hope to foster a sense of belongings and create a platform for survivors to inspire and support one and each other. Last but not the least, we hope to address global survivorship challenges and enhance the quality of life and care for those affected by child cancer. So you can see on the right-hand side of the screen, right now the steering committee consists of different members from different regions, and all of us actually are representing our respective CCI regional groups. So through this steering committee, we hope to bring synergy to the regional networks and collaborations across regions. And we're also very proud to have one of our steering committee member, Sydney, being part of the SIOP Survivorship Network. With this partnership with the SIOP Survivorship Network, we hope to bring bigger impact to the wider networks of professionals, including the pediatric oncologists and the nursing team. So if we are moving on to the next slide, we will see some of the recent updates of what we have been doing since the establishment of SURNet last year. So earlier this year, we launched a survivorship blog on our official CCI website. So that blog is called Survivors Corner, and it's aiming to spotlight some of the inspiring survivors-led projects and initiatives. Since the establishment of the blog, we have shared the launch video of SURNet. You would hear and see all the steering committee members speaking about the key objective of SURNet. Apart from that, we also have posted some of the clarification and fact about survivorship. So hope you would have a chance to check out the survivorship blog on our CCI website. And right now in June, we are celebrating Survivors Week. So we have been sharing inspiring story of child cancer survivors from different regions on our social media accounts, including Instagram, X, LinkedIn, and Facebook. So our ask is very simple. Please check them out on the various social media accounts and share the content to your networks. And next up, we are actually planning future webinars, future open forums and conferences for child cancer survivors to share experiences and learn from healthcare professionals. And this year, as the SIOP Survivorship Network representative mentioned just now, we have conducted a webinar specifically about fertility in March. We are very happy to see more than 100 active participants from 6 regions. And coming to October this year, we are actually having a joint sessions with SIHOP. We have already set out the title and the theme for the joint sessions. The title is named as Mapping of Survivors, Child Cancer Survivors Groups and Survivorship Services Across the World. It is a CCI and SIHOP collaboration. Moreover, we are actually planning to launch our own social media accounts beyond the existing ones that are hosted on the CCI domain. So please stay tuned. It will be coming up very soon. Last but not the least, we are actually looking for passionate survivors who are affected by child cancer to join us in empowering survivors' peers and advocating for survivors' need. So we're actually looking forward to hear all of you from all the regions, from all the locations. So for you to join us, it's very simple. You can see the QR code on the right-hand side of the screen. So please complete the form there so that we can reach out to you and then we can have you connected in our WhatsApp group. And we will be sharing our initiative and our activities on a regular basis. For those who are working in the pediatric oncology field, please feel free to spread the word of SURNet and share the QR code to the child cancer survivors. Hope that we can bring more and more survivors on board to aggregate our voices and to make a bigger impact around the world. So that's all of what I've prepared to share today. So thanks again for the opportunity and stay connected. And we are looking forward to connect with all of you more again in the future. Thank you so much.
Thank you, Patrick. I think it's been an amazing start to SURNet, and the passion and energy is very apparent in your presentation as well as in all the work you've done so far. We're looking forward to more amazing work from all of you. So I think I forgot to mention that in our today's webinar, we're going to have 2 speakers followed by a roundtable of survivors. And we are very fortunate to have 2 excellent speakers as well as wonderful survivors who will be in the roundtable, which will be led by Sydney. So I am very happy to announce our first speaker, Katrin Scheinemann. I'm sure many of you know her. Katrin is a board-certified pediatric oncologist, hematologist, and heads the pediatric hemonc unit at the Children's Hospital of Eastern Switzerland. Katrin wears many hats, and amongst these, she is a member of the SIOP Survivorship Network Steering Committee and is the past chair of PanCare. Katrin will be speaking on the topic, Is there a bright side of cancer survivorship? Over to you, Katrin.
Thank you very much, Maya, for the introduction as well as the invitation. And may some of you were a little bit, what is this weird title? And I got the inspiration from this from a song from Monty Python's, which is a comedian group from the UK. So if things in life are bad, always look on the bright side of life. And I hope at the end you can see some bright side of cancer survivorship. We always have to go back to the start, which was already like over 50 years ago in 1974. And Giulio D'Angio, who was a radiation oncologist, stated cure is not enough, which I still find is such an amazing statement, given at that time that not too many children were surviving, mainly those which disease could be surgically cured and with a little bit of chemotherapy, but not all the others. And he clearly said that it is clear that the child cured of cancer must be followed for life, not so much because late recurrence of disease is feared, as to permit early detection of the delayed consequences of radio and chemotherapy. And careful studies of these late effects must be conducted. What a wise man. Looking at survival curves. This is hopefully the successful story of childhood and adolescent cancer survivor. And here as an example, you can see the curves over time from Germany, but that's similar in any countries with a highly developed healthcare system. And you can see that only for the past 50 years, this has really taken off. And before, clearly we had some survivors, but not too many. You can also see it's not the same for all diseases, and we are not at 100%. So even at the time of like really treatment, there's a lot of things to do. But now we can not only focus on survival itself, but also way more important on quality of survival. And we know that it's not the same across the world, unfortunately, if you're looking here at this graph. But on the other hand, we're such a tight community internationally, not only the pediatric oncology community, but also the one of survivorship specialists. And we will all learn from each other and help each other to get each country to the same level, hopefully. Not tomorrow, but in the near future. Looking at long-term side effects, what have we learned? We know, like with the treatment today, most likely 1 out of 3 childhood cancer survivors will develop a chronic health condition. And as depicted in this like little human, it can affect every organ we have. We know that late effects occur way more often if the treatment is very intense. Just for example, a bone marrow transplantation or even high-dose chemotherapy, but also radiotherapy. But we know that by timely detection and management by a specialized healthcare team, we can do a lot. So what are some highlights in the past? We have now large childhood cancer cohorts with really decades of follow-up time, which is necessary. We do not learn about late effects just only after 2 or 5 years after treatment, but many decades thereafter. I think we're pretty good knowing about the long-term side effects of like chemotherapy and radiation therapy. We know and learned how to screen them and also how to treat them. We know one of the most important roles is the education of survivors and families. The earlier potentially the better, because the survivors have to be convinced by themselves to like really see that lifelong follow-up is necessary. There are tons of models out for survivorship care, so you can really find the fitting one for the setting, depending like really on your institution, on your national setting, but also on your continental setting. And there are a lot of like examples for successful twinning initiative, how you can learn from a relative highly developed survivorship care system and build up your own one. And we have developed a lot of tools. So to say, these are just examples for some guidelines. They are all evidence-based, but they are really recovering from a very highly developed healthcare system to one with like a little bit limited resources. You can see the one from North America, the COGs, then there are PanCare guidelines for the European one, then the matching of both, which is the international guideline harmonization group, but also like one of the newer effort within the area guideline to really adapt them to the resources in like middle and lowly developed healthcare system. And all of this, and this is also an important thing, are freely available. And the same is true for so-called treatment summary tools. You can have like a high version, which is like really electronically based, but you can also have this in paper version, which, for example, you can download on the PanCare website. So you don't have to start like everything from scratch. You can learn like really a lot from others. And all the ones who are like really behind all of this are happy to share their knowledge and all of their skills. In our days, like really our knowledge about survivorship care influences the treatment from day one. What can also help is that our diagnostics have improved a lot. So we can do a way better risk group stratification, meaning that if you are a lower risk, we can really risk to give you less treatment for less side effects. But if you are in a higher risk group, we like really have to intense your treatment. I think we have mastered supportive care, very important one, even something like antiemetics, blood transfusion, fluids, etc. We have learned a lot about chemotherapy scheduling. Most of the drugs we are using still in our days are quite old, but we learned even with them to improve things with dosing and scheduling. For them drugs, we have so-called protective agents, for example, like sodium thiosulfate for hearing loss or dexlaroxane. There we have to say we're still gaining evidence for which indication this is really helpful. We have made a lot of progress in radiation therapy. There are different techniques. Some are a little bit like more preferable than others, but you cannot compare the radiation techniques to today due to a few decades ago. There has also been huge improvement in surgical techniques. Surgery is one of the mainstream in solid and brain tumors, so a close collaboration also with our colleagues there is necessary. One of the unique things in childhood cancer treatment is so-called cancer predisposition syndrome, so that you have genetic syndromes which are prone you to cancers. And there it's like really important to have the knowledge to screen, to test, but also make treatment modification for them. And now more and more, we can also introduce newer treatments like targeted therapy or immunotherapy, always with the goal in mind to have less chronic side effects. And at the end, with all of this knowledge, is there something more actively we can do? And one of the things where we have a lot of evidence is exercise oncology, being active. As early as starting like really under ongoing treatment, but also then with regards to the follow-up after a therapy. And it's like really a lot about staying active, but you have to do it more or less each day. It's like if you train for a run and you stop training, you're starting from scratch again. As we spend a lot of time on the computer or cell phones, there are really some nicely developed gains for neurocognitive health issues. We are getting more and more knowledge also about like medications for this, as this is one of the long-term side effects, which is like really tricky for us from a healthcare perspective to handle. And overall, always it's for everyone, but especially for survivors, healthy lifestyle. Thinking of sun exposure, diet. I talked a lot about active lifestyle already, but also no smoking. So to see a little bit like, where are we going in the future? We need to know what are the like really chronic health effects of newer treatments. And this is a little bit tricky because we cannot use them now and then know in 10 or 20 years what are the chronic health effects. So we really have to implement new research methods to do that while are we using them. We still have to learn a lot and do this better with regards to risk stratification. Does every survivor, even with not a lot of treatment, really needs lifelong follow-up? Because as you all know, what we have not so far really have the solution is the transition to adult care. That's a different treatment, different numbers, and there we often have setbacks. We still have to really find more resources, for example, for psychosocial care and fertility, and don't think that's not true for countries with a highly developed healthcare system. Even in Switzerland, we do not have resources as we want to have them. We need to have funding for survivorship services. There are countries out there where there is no funding immediately after treatment has ended. And overall, it stays the right to be forgotten. At a certain point in life, the story of being a childhood cancer survivor and the medical history should not matter any longer. And that's not the case in a lot of countries. With this, I thank you for your attention and will be happy to answer any questions later.
Thank you, Katrin. That was a very, very good talk. And although it was brief, I think you managed to capture so many things that we often wonder about. I'm sure there'll be lots of questions after this talk. I would request everyone to put your questions in the Q&A box, and we will address those questions during the Q&A session. Our next speaker is Savita, and it gives me great pleasure to introduce my friend and colleague, Savita Goswami. She's a psycho-oncologist at the Tata Memorial Center, Mumbai, and has been actively involved with the after completion of treatment clinic for the past nearly 30 years. She was also instrumental in establishing the psycho-oncology services at the Institute. And Savita currently serves as the chair of the Education Committee for the Survivorship Special Interest Group of the International Psycho-Oncology Society. Savita will be speaking on thriving after treatment, navigating life after childhood cancer. Over to you, Savita.
Hello, everyone. Nice to see you all here, and I'm glad to be here in this webinar. And Katrin has already set the stage, and I will start on the same positive note. I will be speaking about thriving after treatment, navigating life after childhood cancer. So what do we know actually about the childhood cancer survivorship? And the results and the studies have indicated the mixed results. On the one side, it has been always associated with concerns and problems like mental health issues, relapse, recurrence, fertility issues, secondary conditions, neurological issues, and so many. But on the other side, when survivors were compared with their siblings or their peers, it has been seen that survivors, not all survivors, have experienced recovery or adjustment issues at similar level. Some of them have adapted very well. Some of them had difficulties and deeply personal struggles related to their physical, emotional, or existential issues, which were the individual scenarios. But we have to remind ourselves that everything about survivorship is not negative. In fact, these research have shown the positive side of survivorship. It has said that after the long journey of treatment and the process of recovery, parents and survivors have said that they have been mature enough. There is a lot of transformation and there is post-traumatic growth. They have started appreciating life. They have now more value for their family, their relationship, and they look forward to help and be in a helping role. And that's how, so many survivors would like to advocate. They like to volunteer for a cause. So indeed, we have to remember that an important pillar of survivorship care is parents of the children. And parental health, their distress, their anxieties, their worries, their financial hardships, all that can reflect on child's adjustment and child's health. And that's why it is important to address parental health. And definitely we have to have interventions or training for parental education to educate them about communication, introduce them positive coping strategies. So probably that will reflect positively on childhood survivorship navigation in a smooth manner. There are few key challenges identified in reintegration, and this has been across the globe. These challenges are mainly physical distress related to fatigue, pain, and long-term side effects of treatment, returning to school, adjusting with day-to-day life, social isolation, relationship changes, financial hardships, and unemployment. So if we address any one of this, then probably we are not doing good job, and probably that's not which will go a long way in helping survivors. And we need to have a comprehensive integrated model which can address all these issues, and that will probably help more in navigating more with empowerment, and survivors will be more than shine in their personal life. Many survivors carry unseen burden like fears, anxieties, identity issues. Who am I? Survivor or a patient? If I'm survivor, then why multiple visits to the hospital? Why screening? Why so many tests? All these questions create a lot of anxiety. Sometimes it's find difficult to build resilience. And at that point, there's constant need for emotional support. Fear of recurrence has been a common phenomena, and almost 43 to 90% survivors have experienced this phenomena at some point in their survivorship period. It's a constant fear of recurrence which creates anxiety and hypervigilance about their bodily changes. Anxiety related to follow-ups, which triggers emotional unsettlement, and triggers related to scans and tests also create multiple emotional issues. Risky health behavior is another major hurdle in survivorship care. As you all know, and our previous speaker has already said, that poor diet, sedentary lifestyle, substance use can definitely hamper physical health, and it will be a risk for secondary cancers. The most important thing is non-adherence to follow-up care that is going to hamper the lead effect management. Risky sexual behavior, if there is no awareness about fertility issues, no awareness about safe sexual practices, then probably that can lead to unsafe sex, untimely pregnancies, and risk of sexually transmitted diseases. Neglect of mental health can also lead to severe anxiety, depression, and low self-esteem. So we spoke a lot about challenges, but how to gain support for long-term well-being? It's important that survivors and parents take responsibility about identifying their issues, identifying their concerns, and only then holistic support can be arranged. Once they identify their issues, the clinicians and healthcare professionals can make a personalized plan or individualized care plan for every survivor, and that can be then planned according to the requirement of routine screening, not just for physical but for other needs also. Lifestyle changes, we talk so much about it, but do every survivor knows how to take support for their dietary requirements, their exercise, their sleep related disturbance? We need to find out where to go, Do you know your nutritionist, where she is? Do you know the psychologist? Do you know the physiotherapist? You need to identify these services and do regular follow-ups with them. Integration of care requires integration at every layer, and mainly the community involvement. So involvement of community leaders or involvement of NGOs can also help further in helping survivors in education, in vocation, and employment. Uh, there are many psychosocial and therapeutic interventions which are studied especially for survivors. Studies are done with survivors, and these are all very recent studies. And it has been done to find out what is actually helpful for survivors. And it has seen that psychosocial support, uh, fostering hope and quality of life, physical activity, and mobile health interventions or internet based interventions are helping a lot to bring change in maturity, growth, goal oriented thinking, life skills like self perception, self management, conflict resolution, relaxation, social competence. So, in nutshell, it promotes physical and psychological well-being. Integrative therapies, along with medical treatment, has shown positive impact on survivors' health and survivorship process. So, what are the integrative therapies? These are something which I do practice in my professional survivorship practices. Drama, music, writing, role plays, art therapy, adventure activities like camping, going out for nature trails or road trips. These things have been studied with survivor, and it has been seen that it has increased their self-esteem, autonomy, coping, decision making. It has improved their self-image, communication skills, and emotional ventilation. So this is also very age appropriate and dynamic for this age group, those who are young and they want to do socialize and belongingness related activity. This slide is in continuation with the last slide. There are multiple psychosocial support interventions. But how do we get support? We need to find out the mental health professionals who can provide all these services like CBT, acceptance and commitment therapy, mindful-based stress reduction techniques, psychoeducation. All these evidence-based psychotherapies can help you deal with unhelpful thoughts, feelings, and improve behavior. Accept the reality, accept your situation, deal with situation, take some responsibility. Group therapies help a lot, and also the digital interventions. This colorful pictures are of UGM survivors. UGM is a childhood cancer survivor support group, and it actually works for overall empowerment of survivors. UGM has uh, multiple activities throughout the calendar, and they have their monthly meeting, they have the annual meeting, and like UGM, there are many other support groups in India like Can Kids and Kids Can Connect, also Asha, Umeed. And I know there are many survivor support group in other countries which are doing great job. Survivor support group gives a safe space and feeling of belongingness, and that helps a lot in empowering them and coming out with self-related, resolving self-related issues. Here you can see the members are doing drama-related activity, dance, they're out for nature trail, they're art illustrations. So all these activities give lot of internal healing, and it is not, everything is not about physical, and everything is not about getting medicine treatment, but more is about how do you feel, how do you enjoy, how do you actually connect with others. And that's why support groups helps a lot. So the way forward for all of us, and especially for survivors, to sail through the survivorship period, mainly active participation in follow-up care, self-education and awareness about self is very important. Building rapport with your healthcare team, your support system is very important so that you can comfortably access those services. You can speak about your problems. Peer support is important so that you are connected and you can always share things and you can get mentorship. Advocacy and awareness is important, as Patrick has just told us, that how survivors coming forward and doing advocacy. This cause is important. Your um, experiences are important. So advocacy can give a lot of self boosting and self confidence. Contribution to research activity is important, and policy making is definitely very important, because uh, your participation in this is important, because your experiences, your opinions are valuable. On the basis of that, many things can change. And very important thing is having a goal for a life and living meaningful life. Reintegration is deeply personal, so there is no comparison. Each survivor is unique. A holistic, compassionate approach is the key for thriving and surviving after the whole treatment. Healing does not end with treatment, but it is a continuous process at every step forward. And not to forget that heroes comes in all sizes, so believe in yourself. So this illustration is from one of our UGAM members, Shweta Chowre. Thank you very much.
Thank you, Savita. I think this was a very nice and very positive talk, and I think everyone feels good after this talk. Thank you very much. I think we'll go on to our Q&A session right now, and we already had a few questions in both the chat as well as the Q&A box. But before we go on to that, I would really like to thank Zhao, who's been a silent participant currently in the webinar, but he has been extremely active in organizing this webinar along with Julia Shalinor. So thank you very much, Zhao. I think we'll go on to a few questions which were there. The first question, Katrin, would be, I think, to you. One question is whether there is a chance of developing a second cancer if you have had cancer in childhood.
The answer is yes, due to the treatment received, but it's hard to put a number there for an individual survivor because it really depends on the treatment you got, which chemotherapeutic substances, if you got radiation therapy, but that should be also part of your survivorship care, this surveillance for potentially secondary cancer. And it's completely different, obviously, if you have a so-called cancer predisposition syndrome.
Thank you, Katrin. I think the second question would also be something for you. Is it safe for a leukemia survivor to have a child as a female? So is it safe for a female leukemia survivor to have a child?
The answer is clearly yes. There is no risk. We have large cohort studies, especially from the Nordic countries, who have shown that there is no risk, no fear besides a cancer predisposition syndrome, but that something like is really affected or will affect your child if you are a childhood cancer survivor.
Thank you, Katrin. There was another question, and please, I would request everyone who's on this, watching this webinar, to please keep the questions coming. There's also an option to post these questions anonymously in the Q&A box, just in case, it's a sensitive topic. The next question is, again, it's been sent to Katrin. What computer games would Katrin recommend for neurocognitive support?
There is not a one fits all. It really depends a little bit like where the issues are. So if it's more like attention span or reaction time, and then you can pick and choose. There is not a one fits it all, and it does not need to be an expensive one. We have a lot of like freely available if you're thinking all of this sorting stuff, patterns, times, etc. But it would really help if you have a so-called neuropsychological testing and to really know where are your strengths and where are your weaknesses, and really look especially at the weaknesses.
Thank you, Katrin. Next up is a question to Savita. Savita, should all survivors be assessed for mental well-being? And if so, when and how often?
Yes, I think survivors should be assessed for their mental health uh, evaluation, and but I think it should be a short screening when they come to their follow-ups, because every time there's no need to go for detailed evaluation, and it can be done as it is. The survivors are following either on a 6-month basis or yearly basis. So this short screening can be done on their follow-ups, and that will, because in the given time, if there's any new change in any new symptoms, so that can be captured with that screening.
Okay. So the next question, I think either of you could answer it. It is a little general, and it's from Marcella. So Marcella says that I'm about to start a satisfaction study with the service received at the Childhood Cancer Survivorship Clinic. Do you have a validated questionnaire specifically for this population? So it's for a satisfaction study on services.
There are satisfaction questionnaires, but now it is important to see uh, um, the patient population is in which country, the language, because it needs to be then standardized accordingly, and it should be tailor-made also. And definitely, I think satisfaction questionnaires are always self-reported, so very young children can't be taken as a part of the study.
Katrin, would you like to add to that, or would anyone else like to add to that?
I can only say for Europe, there's one developed within the PenCare follow-up project. So as Savita already said, it really depends a little bit at the end. Sure, you can take a validated tool, but for something like that, you can also do your own questionnaire with just 5 questions. I think the most important thing from us to say, don't make it too long and too comprehensive, because then the return will be less. Short and precise. I think for any questionnaire, that would be my advice.
And for young children, I think pictorials are very useful if you have to get satisfaction feedback from children, young children.
Right. So I think I'm just wondering if, quality improvement initiative could also be, one way of doing this. You do this, do a questionnaire in the beginning, do an intervention, and then maybe assess it later. Next is a series of questions, I think, which, so many of us get asked very often. And I'll just put it in the form of 2 or 3 questions to both of you. Often young people who have been treated for childhood cancer are unaware of the details of their cancer diagnosis. And what is the best age to educate them on their cancer history and long-term follow-up? And what are the reliable sources of information? I think, Katrin, you already mentioned some of those, but specifically, could you mention that?
Thank you, Maya. So I think the age, I would diplomatically say it depends. The earlier, the better. I think latest while they are teenager. And then for us as pediatric oncologists, we also have to learn maybe to send the parents out and really have a one-to-one chat so that they feel safe, that they can ask the questions. We have the first one who are coming on their own for a survivorship clinic, like really at teenage age. There are huge differences, but I think we have to take every opportunity, as I explained before, because the survivor has to have the full understanding of the disease, its treatment, and what he needs in the future. And regarding sources, at least for Europe, I mean, the best one is PenCare, because that's also translated in a lot of other languages, but a lot of countries also have at least one website in the national language with information. So there also, like, there is a lot out there, and it does not need to be completely built up from scratch.
About diagnosis disclosure, I think it's a continuous process. It's not one-time business. So, and when children are very young, they still understand something about it. So it's important to start communication. If they're asking questions, allow them to ask questions, give age-appropriate explanation, and then gradually, when they are at the age of 9, 10, or up to as per their maturity, when they're able to understand their diagnosis, then they should be told. But the process of telling truth should be a continuous thing by the parents and by the professionals as well.
Right. Thank you very much. Thanks, Savita and Katrin. There is a question. How would you qualify a survivor and a long-term survivor? Survivors have so many ages, and it is difficult to serve all according to their need.
The definition of survivor is little, so yes, the newer definitions always say that from the time of diagnosis, you have been called a survivor. And the long-term survivor is somebody who has, completed the window period of, the initial risk. And so that could be 2 years or 2 years of observation period. And then after that, 5 years of follow-up. And then probably that call long. I think Dr. Maya, you will be or Katrin, you will be the best person to define that. But I think as per newer explanation, survivors from the diagnosis, you are survivors.
Thank you, Savita. I would agree. I think that's the only thing clear, that we would say survivorship starts on day one. And when you do the switch from survivor to long-term survivor, that really depends a little bit. I don't think there is like a really official definition in a way. Each project, but also every country uses a little bit, like, due to their own needs and guidance.
Thanks, Katrin and Savita. Katrin, I would just like to ask you something else connected to this. So how long is long-term follow-up? How long do we need for survivors to come for follow-up?
This is a good question. I mean, if we're looking poorly at the evidence, we would say lifelong. But sometimes it's, from a practical point, honestly, not lifelong any longer, and things are going well. I think this is one of the big unanswered questions, I would say, because you don't want to keep someone longer than it's really needed. But as we all have seen from the research so far, that like chronic late effects have no plateau, at least what we know from like the childhood cancer survivor study or the St. Jude's lifetime cohort. It's really hard, but I could definitively think that someone with like had a relatively mild therapy that we could stop earlier. But at the moment, I think it's more like a discussion between the health professionals and the survivor than that we have clear evidence for that.
Thank you. I have a very difficult question, and I hope both of you are able to answer this. So from both your perspectives, what can be done to improve communication between health professionals and young people who have finished cancer treatment?
Katrin?
I mean,
yes.
Please, Savita, go first.
Please. So I think, as I said, communication developing a rapport is important, and I think physicians gets more opportunity to interact with the survivors. So giving enough time, not using jargon, and simplifying advice in their language is more important. And many times in the clinics, it becomes very formal. So sometimes if there is group sessions or if there are tele sessions where if survivors can be addressed in a group, so probably that will help in improving communication. And I think many other things which practically not possible considering the day-to-day workload. Yes, Katrin.
Yeah, I would agree with all what you've said, Savita. From a practical point of view, what I often see, so you have the treating oncologist, you finish treatment, and then you go to the survivorship care specialist. And I think this step have to be like carefully planned and introduced, and they have to meet up because I mean communication also has a lot of to do with trust. You communicate very well if you trust the person, and this goes both ways. So it's a process which has to be prepared and then also like followed up. And I think successful survivorship care can also only take place if the survivor really trusts the healthcare professional who's taking care of him, because otherwise if he does not speak about like mental health is one of like really the things where you really need the trust. It's maybe a little bit easier if you have physical issues, but I think that something is like really important. This is a transition step, and as always it has to be gradually and well prepared.
Thank you. Thank you very much. There is another question. Um, and the question is there an increase in long-term effects, or is it only that we are now researching it that we are aware of the long-term effects?
That's a little bit a tricky question because like for this survivors weekendasis clearly now are the ones maybe treated before 2000 where we have like really a long-term follow-up, but also think that this treatment looked quite different from what are we doing today. So it's a little bit like hard to say at the moment. We have to say yes, purely from an evidence point of view, but we all hope, the ones we are currently like really treating patients, that this will be different in the future. The issue is at a certain point, clearly, what is still a late effect of the treatment and what is just like normal aging. You all know it's always so that potentially a childhood cancer survivor, all of this which comes with normal aging comes earlier. But at a certain point, I don't think we can say for 100% this is clearly a late effects of your treatment and not something you would have gotten anyway.
Thank you, Katrin. I think I think this was a very, very interesting Q&A session, and we'll go on to something that's even more interesting, and that's going to be the 2 questions which we are going to launch as a poll. We'll be doing that. Thanks so much, Savita, Katrin, Nurdan, Patrick, and everyone else who's been here so far. Please note that this poll is for survivors and parents. I hope all of you are able to see the poll and please vote.
As we wait for people to continue filling in the poll, I just want to thank you, Dr. Maya Prasad, for being my co-moderator. You've done an amazing job, and your passion for survivorship clearly shows in the work that you do. So I'd just like to thank you for everything that you do as we move on to the next session, which is just going to be having some discussions with some people with lived experiences. Maybe give it a few more minutes, then we can just share some of the results. As we wait for that, let me take this opportunity to introduce myself. My name is Sydney Chahonyo. I am a cancer survivor from Kenya. I am now 20 plus years of living cancer-free post-treatment. I run an organization called Hope for Cancer Kids in Kenya, and we support kids who can afford cancer treatment. We provide awareness. We create awareness. We provide access to treatment. We do a lot of advocacy, and we are involved in building the capacity of the children and caregivers. I'm not sure. Are we done with the poll now? Please keep answering the questions if you have not finished answering them. I think we're about 54% right now. But I think that's adequate. Maybe you can just share some of the results. I hope you can see the results. I can see about 37% of people are in long-term follow-up, regular long-term follow-up. 44% are not. And mostly this is with a mental health professional or an adult doctor. Very few, about 4% with their pediatric oncologists, about 4% with a physical therapist, and about 11% with a survivorship clinic. So I'm glad to see that there is some sort of follow-up being done, but I feel like there's a lot of work to be done. So thank you very much for participating in the poll. I think we'll now just move on straight to the next session. Today we're talking about childhood cancer, a new chapter, adapting, connecting, and moving forward. And it is my pleasure to be able to take you through the next session. I'm just going to share my slide for a minute, just so that I can introduce you to the panel that is going to be speaking. I hope you can all see my slides. In the next session, we're going to have a panel discussion, and we have some people here with lived experiences. First, we have Verda Chora from Ankara, Turkey, project manager, and she's a survivor of Burkitt's lymphoma. We have Julia Sena from Brazil. She's a survivor of osteosarcoma. And we have Rabi Wakas from Pakistan. He's a fleet manager, and he's a survivor of acute lymphoblastic leukemia. I think it's very good to see how the discussions have been so far, especially from the medical side, with all the guidelines, with all the treatment tools that are available. And it's also good to see that, the medical side are also working on ways to support survivors, whether it is mental health, whether it is thinking about relapse, fear of recurrence. So it's good to see from the medical perspective that there are things being done that can be replicated in other areas where maybe there's not much that has been developed. So right now, I want to just invite our panelists to put on their video. I think I can see all of you here. And we're going to start where where Maya left off. And we're going to talk about communication. So I just want to ask our panelists, from your perspective, what can be done to improve communication between health professionals and young people who have finished cancer treatment? Julia, you can go first. and just introduce yourself as well.
Okay, thank you. It's a pleasure to be here with you all. I'm Julia. I'm a cancer survivor, osteosarcoma, as Sydney mentioned. I do think that to improve communication, it's important to add some aspects that Katrin and Savita mentioned, such as understanding all the insecurities and all the doubts that come in the patient mind when you think about what am I going to do next? Because when I first found out I was sick, I was 13, and as a 13 kid, I wasn't sure about what was really happening, and I couldn't understand the medical terms, and the environment was too different from what I was used to, because before that I was just playing and just going to school. So it's a new context, and I do think that it's important to consider what's most valuable for the kid, and how can you explain considering those aspects to make sure that we're going to feel safe and still receiving support, going back to our previous routine.
Thank you, Julia. I'll come back to you. Vida, what do you think about what can be done to improve communication?
Okay, thank you for being me here and the invitation from the CCI and SIOP to give this opportunity to me to share our experiences with the audiences. In my opinion, for the long-term care, there are three main focuses. First one is the emotional side of the post-treatment follow-up and the importance of normalizing follow-up care for the children. And of course, use of digital tools to help understand survivors better because they really have struggling times. For the emotional side of follow-up care, as the treatment itself, this is unique for each patient. I think follow-up care should be unique to each patient also. To tailor it, to personalize it, maybe post-treatment surveys maybe can be done by the clinics to put the strategical and tactically true follow-up care for each patient, which makes them feel better, feel less anxious about the process. Maybe some of the patients cannot feel better to be in the hospital because of the revisiting the old times of the treatments. Some of them can feel much more better. So understand their emotion is, I think, important. The other topic is making the follow-up care session is a new normal because it is the condition that they have to live with it. And it is not to search for the bad news. It is only the long-term healthy status of their lives. So making them believe that it is the new normal, the healthcare professionals should contact with each patient, again with a customized way. Also, the role of technology and digital tools can help the process because especially nowadays technology can play a very powerful role in every aspects of area. Making them using digital surveys or digital diaries can help healthcare professionals to understand the situation of them better. Thank you.
Thank you very much for that very interesting answer. You've covered a lot of different topics. Adekemi, what's your take on that? How can we improve communication between healthcare professionals and young people who have finished cancer treatment?
All right. Good afternoon or good everyone. Thank you, Sydney. Thank you, everyone, for being here. So I'm going to look at things from a different perspective. Coming from Nigeria and being a 25-year childhood cancer survivor, I was quite young as a person as well. I was 8 years old when I was diagnosed. And I think that just like Katrin said, it's never too early to start communicating with the children or with a young adult with childhood cancer or adolescent cancer. There's actually looking at it from a different angle in terms of how do we even see our healthcare professional? Do we see them as part of the value chain, or we see them as a strong hierarchy, someone that you can speak to, because when I look at our setting, it's usually from that angle. You see that most patients or parents have a challenge with communicating with the healthcare professional. So for me, I think that having to see things from bridging the hierarchical gap, knowing that doctors and patients are one and we are working towards a particular goal, is actually the best way to even navigate the new faces in terms of communicating and making sure that patients do not feel intimidated. We must intentionally, as healthcare professionals, also create, especially from my own setting, a youth-friendly environment, spaces where there is open dialogue. Open dialogue is encouraged, questions are welcomed, and you don't feel like the patient is asking too much question. Let them feel heard without being fear of being dismissed or judged. When we look at our patients as being, I mean, as a project manager, you say people you're delivering value to are part of your system. So when you see that those that you're delivering value to are part of the system, we make them feel welcome, we make them feel comfortable, and communicating will be much more easier when we look at things from that perspective. So I think it's more identifying what the challenge is and trying to, bridge the gap from that point of view. So that's my own experience, and that's what I think we can begin to do to make our communication better between the healthcare and survivors.
Thank you very much, Adikemi. What about you, Rabi? What do you think can be done to improve communication?
Thank you so much. Actually, this is first time I'm attending any online webinar like this, so maybe I did some mistakes. So sorry for this. In my history, I was suffering for the ALL, as you already mentioned it. In the communication, when I was suffering from this treatment before 20 years, I was searching the people who already is a survivor, who already suffered this all of things, and I was talking too much to the many people that is there anybody who is a survivor, who suffered this all of the things, and I want to learn many things from them. Like many question was in my mind, and there is no answer. Nobody can give us that time the correct answer. Even I discussed with the doctor. Sometimes doctor said that why it's happened with me, like why the cancer happened with me. So communication is the key of like if you communicate, if you can give your message, if you can give your experience for cancer experience to anybody. Like many families are sitting there, and everybody, if you see their face, everybody having the many of questions. My children will survive, because I was not too young when I'm having the cancer. I was 17-year-old that time, so I can understand each and everything, the face of the people, how disturbed they are, and I can feel their pain. Many of the small kids, 6-month-old, 1-year-old, 4-year-olds, was getting the treatment. So during the treatment, I was searching many of the survivors. That's why I joined this platform, that I want to support the guys who, like me, who are searching and who is having the question to ask, to understand that what to do, what not to do. So if there is a group of survivors who can give their answer question, we should communicate with the patient that okay, this is the disease only, and you just do whatever you want, just do what you love to do, and just focus on your other things only. This is the process. Now you have to gone through this process. Okay, you cannot do anything. There is a way only, the treatment. Take your treatment, and but for sure there is when you go home, you have after your chemotherapy or after your medicine, you are taking medicine, there are many things in you are going through by like psychologically. You have many of questions, like maybe I will die, or maybe I will not survive. This kind of question are moving around during this treatment. Even after this treatment, there is a period of maintenance period, you can call. So like during this treatment, I faced many things which I can explain if this webinar is so small to explain all my experience. But the small things that the behavior of the people during the treatment, you are taking the chemotherapy, you are very weak, and when you go outside, the people, how they are treating to you. So I think we have to educate the people, even not only who is taking the treatment, the people outside from the hospital that this guy already suffering from the very hard time. So at least if you cannot give him the smile, if you cannot give him the good words, don't don't give him the hard or bad words. Don't use bad word for him, or do like this, oh, you have a cancer, okay, like you are taking a side from him, or you are wearing the mask once you see him, or you are eating something and you are giving him food to another plate, you are using another cup for him. So it's quite difficult, it's very disturbing for me as a survivor.
Thank you very much, Rabi. We'll get back to you in a minute. And I want to take all of you back a little bit to your journey. And I want you to share a little bit about an experience where a health professional was supportive and informative after you finished treatment and had questions about your mental or physical health. So this is now post-treatment. Maybe you can start with Verda. Just an experience.
Sure.
Yeah, go ahead.
Actually, from our own experience, we were very lucky because during the treatment also, our doctors didn't just focus on the medical results. They also paid attention to our children's feelings. That human connection, I think, made a huge difference. It helped us to approach follow-up visits with more confidence and less fear because our children was 12 when he was diagnosed and became a survivor after the treatment has been finalized. He was 13 and in the adolescence age, he had some anxious, but because of our doctor's approach to be open, very open about the results of the long-term effects and results of the disease that he had, we really made it much more easier. Also, we learned that it is very important to educate ourselves firstly, and then our children to understand the new lifestyle, the effects of them, eating not everything, to be careful about some things that is very normal for the normal children, and to behave as a fragile person, maybe I can say. But we felt very fully informed about what would happen, and it helps us a lot to process on the long-term care treatments, I can say.
Thank you very much, Verda. Adekemi, what about your perspective?
Okay, so unfortunately for me, I didn't have opportunity to engage with healthcare professional about my mental health. In fact, I have a mental breakdown during my remission, which was a big deal because as I was told, I woke up from a sleep and I was wandering around. It was one of the days that I'd gone for my follow-up care. And I think I was a bit overwhelmed about the experience because I had to go to the hospital like every 2 weeks. And so when I got back home, I have that, breakdown. And I didn't have anyone to navigate that experience with me. So it was a function of my family just trying to navigate things and figuring it out for me as a person. So I grew up with that experience and not unable to unleash the experience that I had. But as an adult, more now into advocacy, sensitization, and awareness, I eventually enrolled myself into a mental health therapy, sort of, to kind of help me to outgrow that experience because I think that it formed a bigger part of my growing up. And for a long time, I couldn't express that feeling that I had. So I never had that mental health coach or session at any point in time. No one spoke to me about it.
Thank you very much, Adekemi, and that just shows that there's still a lot of work to be done, especially post-treatment when it comes to mental health. Julia, do you have any examples from your experience of when a health professional was very supportive?
Yes, I do have an example. Actually, when I found out that I was going to start transitioning officially to adult care support, that was a big moment for me because when my doctor came to the room to tell me that I was free of the hospital and having to go there frequently. That was actually a sad moment for me because I was feeling a lot of doubts, and I was feeling so much fear about not being able to continue to having my pediatric with me. And then she informed me, she hugged me, and she was standing there watching me cry, but also she told me that I was going to be able to do whatever I wanted in life. So she changed my my fear into something optimistic about transitioning to adult care. And that was really important to me because I felt like I was losing my pediatric. I was losing someone that I have built so much rapport and trust. She became someone so meaningful to me, and hearing those words from her was really important. And that was the moment where I felt like I was starting to, as Katrin mentioned, seeing a bright side of survivorship and a bright side of like moving on. So that was a moment where her behavior and her communication with me was really important to not only guide me from that moment forward, but especially to support my feelings and be with me in this transition, you know.
Thank you very much, Julia. Rabi, we're back to you. Do you have any examples post-treatment of where a healthcare professional was supportive?
Yeah, actually, when my treatment was going on, so there is a department where all psychologists was there. They are coming to you daily. So after treatment, also they come to you. They meet with you, and she was explaining that okay, like after treatment, what you can eat, what you should eat, or what you need to do. So. But problem is that after this cancer, your life is not same as before. Your life is not normal. The people are saying, okay, after the cancer, your life will be the normal. You can live normal life, but it's not true, because the trauma which you was going through, it will be for lifetime. You will never forget the things which you gone through and what the treatment you are getting, what the people, because during treatment you meet many of the friends who was sitting with you, and then when your treatment completed, so I'm the lucky one, but the many of people was died. So this is also sometime you remember the thing you are sharing with them, they are sharing with you. But for sure the doctors, they are supporting, they are telling you the everything, how you need to react. Even my doctor, when I meet him during the chemotherapy, he always said to me that don't think too much, and if you are thinking, you will not get anything. Just do what you love to, like you, if you want to play cricket, do and play cricket. You want to play the game, just play the game. But the problem is that I'm not much child, that I don't want to play the game, I don't want to do anything that time. That is the issue. I was just focusing on me, why it's happened to me. I have too many questions, who can give me the answer? This kind of thing, the time will tell you the answer. Nobody can tell you the correct answer, that what your life will be. Okay, so it's you need to think about yourself. Okay, it's good to do what you want to do. Actually, it means like it, if you love to do anything, just do it the same time, or for the time being you can divert your mind only. But meanwhile, the main thing is that you will never forget what you are going through in this, during the treatment.
Thank you very much, Rabi. I just want to remind everyone today that the recordings will be available on both the SIOP and CCI platforms, including the SIOP YouTube channel. So as we move into the next and the final question for our panelists, I just want to ask all our panelists, what do you think can be done to improve survivorship support services in your setting? We've had about different perspectives from different countries with different resource settings. Some have survivorship services available, some don't have much. So I want to start with you, Verda. What do you think can be done to improve survivorship support services in your setting?
Okay, in our case, we are very lucky that we can touch our doctors directly. but I'm sure that not lots of patients or families have this chance. So I think the guidelines that has been emphasized during the presentations should be widened and to be open for the families and the patients also. Of course, not every type of cancer treatment is the same, so the post effects will be the same, or the secondary cancer conditions are not the same. There should be tailorings in accordance with the treatments that have been taken and the diagnosis conditions. And I think they should be incorporated into the medical plan of each patient. In addition to the cancer long-term treatments, having some regular checkups for a healthy life to behave as a normal life should be added into the long-term care treatment. Also, I think the CERNET is a very good platform for this opportunity. Connecting is very important because in addition to the medical treatment, of course, it is the beginning, but the mental health and the hoping for the life is very important for the survivors. So connecting with the people like themselves is a very important aspect, in my opinion. In our country, there is not too much opportunity to meet with the people, but when you meet a people or a patient or a survivor, you feel very lucky that you can share the same emotions, that you can share the same experiences and get their knowledge and experience easily. So I think the written and formal long-term treatments as a medical aspects and the connection with the other survivors should increase. Thank you.
Thank you very much, Verda. And that is one thing that we are working on at SANET, just giving survivors a space to belong, a space to share experiences, share knowledge, and at the same time working with the SIOP survivorship network to be able to find out where are these services, where can they be accessed, and then connecting those survivors with the services. So Rabi, I'm going to go to you next. What do you think can be done to improve survivorship support services in your setting?
As Varda mentioned, that connecting is the best way. If you connect the more people, and we have a platform like SORNet, so this is the good platform. This is the first time I connect with some kind of the people all over the world can share their experience. I think this is the good platform to join and give awareness to everybody.
Thank you, Abby. What about you, Julia?
I do agree with all the comments about this. I do think that in my country, people are not that aware of all the resources and all the support that is already there. So not being able to access that is a lack, and it would make a whole difference. And I do think that connecting is the key. I do think that while you are going on treatment, people find this bubble, this connection, and after the transition to long-term care, it might disappear because people go to their individual lives and outside the same environment. So connecting would be the key to keep moving and feeling like you belong and you are supported by all the things that are available.
Thank you very much. Unfortunately, one of our panelists had to leave the meeting. So I'm going to speak on the African perspective. And most low and middle income countries usually do not have any support services. And if they do, they come at a cost which a lot of people cannot afford. So I think this collaboration, I think, is very important between SIOP and Childhood Cancer International, because at the end of the day, what we are trying to do is ensure that as much as, sometimes you feel like once you become a survivor or once you finish your treatment, everyone forgets about you. You just have to move on with life. There are no support services, but these services actually exist. And if you can learn from, high income settings where there are programs, there are protocols, there are survivorship services, and see how to integrate that into the lower resource settings and low and middle income countries, while at the same time just giving the survivors a place where they can come and access resources on survivorship. Post-treatment plan. How do I deal with some of these long-term effects? Where in my country or where near me can I find these services? So that is just something that it is the beginning, because both networks are fairly new, but I feel like it's a big step in the right direction. And going forward, we will be able to have better survivorship services available to more people. So I think so far we've had a good discussion. I just want to find out if there are any questions from anyone out there. And as we wait for the questions, feel free to put your questions in the Q&A. And as we wait for the questions, maybe we can just launch a poll. We just want to find out, we've been talking about various topics today. We've touched on very different things, mental health, whether it's protocols. So we just want to ask you what topics you think you'd be interested in being presented in future survivorship webinars. So I'll just ask everyone to just write their answers. And then from there, we can have a better idea of how to improve the sessions going forward. Yes, the poll is up. Kindly write in your answers. And I just want to, as we answer the poll, I just want to ask our panelists just to speak one word. Whether you can speak to a mother whose child has a cancer diagnosis. Rabi, you can speak to a fellow survivor who might not know or where to get services, or someone to just connect with. Julia, also just what is your parting shot? What would you say to survivors out there, or caregivers or parents of survivors out there? We'll start with you, Vada.
Actually, the first thing is adaptation. Because it is the condition that you can't hide. So you have to adapt your treatments. You have to depend on your doctor's decisions. You have to be very high motivated and give very high moral to your children. From our case, when we first learned the diagnosis, we were collapsed, of course. But after then, we believe that these days will go on. And at the end of the treatment, my son has made a conclusion that it was 51 good, 49 bad. When I asked him why, because this is the experience that I never imagined to have. I learned a lot from the process. So, of course, it is a very, very hard and struggling process. Firstly, for the mothers, please always give high motivation and moral to your children, and really adapt condition and collaborate with the doctors, collaborate with the nurses, and obey what they say. That's all from my side.
Thank you. What about you, Rabi?
Actually, I was listening, Varda. I forget your question. Can you ask again?
I just want you to speak to any survivor out there who maybe has just finished treatment, or someone who has just got a diagnosis. What would you tell that person? What do you feel you were told at that point?
At that point, I just want to tell them that just focus on your this time will pass on. Okay, the time will not be the same for you, inshallah. After the treatment, the same day will come when you was playing, when you are watching movie, when you was doing your hobbies. So this is the hard time, we know that, because during the treatment it's very difficult to find the person, or to find the peace in your mind. Your mind was going, so better to do what you love.
Thank you very much, Rabi. What about you?
From my perspective, I do think that one day at a time really represents like to be calm and trying to live each day thinking about
okay, what is going on here, and then moving to the next day with optimistic and obviously respecting the feelings and emotions. As Verda mentioned, it was really important for me to receive my family and friends support, so I could feel like, okay, it's just a tough moment, but it does not represent my whole life and my whole journey. It is just a chapter, and I'm going to be okay. So that was the message I would like to share.
Thank you very much. We want to ask everyone else who's there, please to answer the poll question. We still have some time to take your poll answers, so just let us know what you're interested in hearing going forward. From my perspective as a survivor, one thing I want to tell you is you are not alone. There are many other people who are going through this journey at different stages with different experiences. You are not the first person to go through it. I know everybody's journey is different, but there are people who you can talk to. There are people who you can reach out to. And I want to say also that for me, I took my journey step by step, day by day, moment by moment. It's very hard to think to think 35, 12 months down the line, when you're going through chemotherapy. And for me, it was just, I just need to get through this day and I need to stay positive. And for me, staying positive was one of the things that really held me, especially on my dark days, on the hardest days, just telling myself, I'm going to do this. I'm going to do the best I can. I'm going to be strong. And I think that's one message that we should send out there, regardless of, what stage of treatment you're in. You need to keep being positive. But I'd like just to tell everyone that cancer should not define you. Cancer is a disease. If caught early, if you have access to treatment, you can survive cancer. And this panel is just, proof that there is life after cancer. We have all gone on to do other things. I am now a father of 2 girls. We have jobs. We are, making changes. And we are also, in a way, trying to give back and find a way to make sure that everyone out there who had the same experience that we had has access to support, has access to somebody else with a lived experience, and knows that there's somewhere you can go to get survivorship services. So I want to thank our panelists again. I think there's somebody who wants to ask a message for somebody. Lorena Sen has asked in the Q&A for you to give a message to someone who is undergoing treatment, maybe someone who's just been diagnosed. I think some of you touched on that a little bit, but I want to open it up to all the panelists. Someone who is undergoing treatment, what would you tell them? Or a mother whose child is undergoing treatment? Anyone want to take that?
I do think that what you just said, Sydney, about that's not your whole life. You still get to do everything. The diagnosis doesn't mean that your life has stopped or freezed completely. You can still learn how to adapt your dreams or to start to planning new things. So this is just a moment. It's not your whole life. So I would focus on that. And again, you're not alone. So please connect with the groups and all the supporters available, because I know it can be hard, but it is harder if you're like being alone. So please don't. We are here, and the CERNET and all the resources are available. So I'm hoping that you can see this as a tool to handle this tough moment, at least for now.
Thank you very much. Verda, do you want to say something?
Actually, not to add more. As I said, and Julie and Robbie mentioned, this is a chapter, and it will, I hope, not to be remembered, but of course it will be remembered. But it is important to remember what has been done. So focus on the good things, focus on the good vibes, make their motivation and moral and very high for the mothers. That's all.
Thank you very much. Rabi, what about you?
For me, the parents, I will say that you have to be strong, because your child, when he is having a cancer, the first thing he will look the face of the father and the mother, how they are treating. Maybe if they are upset, so he will be upset more. You have to be strong, give him a smile, give him whatever he want, and for the treatment, for sure, just give them the best thing for him. Just stay away for the like in my country, I'm from Pakistan. You usually you could not find outside the healthy food. Okay, that is the challenging. So for the Pakistan, I will say that for the mothers, cook them well at the home, because during the treatment, when you're having a chemotherapy, if you eat something from outside and you have a infection, so you have two treatments, one for this infection and second for the chemotherapy. And maybe through because of this infection, you having the diarrhea and your body is so weak. So just focus on the treatment, forget about the disease. Okay, your this time is for the temporary, hope for the good things, and the days will pass on. But this time your children need your support. Give him the just positivity only, because there is too many negativity around you. Because when I was going through in this, many people died, so I was thinking a lot, maybe I will die also, I don't know tomorrow what will the next. So there are many questions for going on in the same time. So for the mothers and the father, I will say that just give him the support. You are the one who can support your child only. He is not like listening to anybody. He just listen the patient who just listen want his father and mother, and you are the one who's the hero for him.
Thank you very much, Rabi. I think we're going to take one final question. And I want to start with you, Verda, because the question is actually, what would you say for someone who doesn't want to get treatment? And I know, especially when it comes to childhood cancers, that's very important because a lot of the decision making is in the hands of the parents. And sometimes, even here in Kenya, we get people who say, we don't want to go for treatment, maybe because of myths, or they think, cancer is a death sentence. So what would you say to encourage someone who has been told your child had cancer and needs to start treatment, but they don't want to do the treatment?
Actually, I believe in science, so there is no option to not to take treatment. It's a very risky death game. There are lots of opportunities, as our professionals mentioned. There are lots of treatments, immunotherapy, radiotherapy, chemotherapy, etc. And there are lots of additional treatments to reduce the effects of cancer treatment. So as a mother, I never thought of not to getting any treatment. Of course, we have very hard times, but with the help of our healthcare professionals, we handle them. So I think it is not an option, and it is the worst thing for the parents in terms of their children to take this decision. Yes, there are lots of myths when the issue is about the cancer, but cancer is a disease. It can be treated, it can be cured. As you mentioned, Sydney, you are the real persons living after cancer. Also, after my son has been survived, I think, talk about 15 parents about the process, and all of them have been survived and living in a healthy condition. So for any parents that do not treat their children, I think it is not an option.
Thank you very much. I'm going to finish up with you, Julia. What did you say to a young person who has just been given a cancer diagnosis, but they don't want to get any treatment?
I do agree with Verda. I think that the parents' guidance through this is really important, because obviously as a kid, you'd rather be doing anything else. You'd rather be watching TV or playing with your friends. And the treatment is really exhausting and it's painful, and it requires a lot from the patient and the whole family. So I do understand this fear. And I remember
thinking, I remember telling my mom, like, Mom, do I still need to do the surgery, the surgery, one of the surgeries? And she told me, like, yes, you do. I'm here with you. We're going through this together. So I know it can be hard, but I do believe in data. And as we saw, the data and the insights, the rate of success in treatments has increasing each year. And I also, for me especially, it's really important to have faith, and the faith is an important part of our lives, but it must be matched with the actions and the support from the medicine and the doctors. So I would consider those aspects, because not doing anything might be dangerous. And I do know that the earlier you find out and the earlier you start the treatment, the more you get those rates increasing of success. So that was that was the point for me, and that's what I say to someone that is going through this now.
Thank you very much to all our panelists. I really want to sincerely thank you all, Verda, Adekemi, Julia, and Rabi. I also want to thank our other speakers who gave wonderful presentations. I want to thank the hosts, the planning team, and all the other panelists. And at this point, I just want to say that I think we had a wonderful webinar. We've had great numbers. We've had the beginning of a very interesting conversation. And I think there's going to be a lot of follow-up from this webinar on what are the next steps. How then do we come together and make sure that survivorship services are actually actually accessible, and they are meaningful, and they are relevant to the survivors. So I want to thank you all also for answering the poll. That's going to just help us get an idea of what our future webinars are going to be about. So at this moment, as we close, I just want to have the pleasure of inviting someone very special in the cancer space, of introducing Dr. Guillermo Chantada. Dr. Guillermo Chantada is a pediatric oncologist who is the current president of the International Society of Pediatric Oncology, also known as SIOP. He's the head of the outreach program of the Pediatric Cancer Center Barcelona at the Hospital San Joan de Déu in Barcelona, Spain. And he's the scientific director of the Foundation Perez Cremini in Montevideo, Uruguay. His areas of research are mainly devoted to retinoblastoma, new therapies in retinoblastoma, and lymphomas. So at this moment, I want to introduce Dr. Guillermo. I think he sent in a video. Please go ahead and play the video.
Dear friends and colleagues, it's a great privilege for me to say these words to open this new edition of our Survivor webinar. SIOP is proud to organize this event in association with CCI, showing once more how strong our partnership, our shared mission and commitment are. The SIOP Survivorship Network aims to build a global network of interested healthcare professionals, address relevant issues across all resource settings, and foster the development of resource-adapted and sustainable survivorship care. We aim to increase the number of children that are cured of childhood cancer. We want to cure them all, indeed. But in some low and middle income settings, there is a lot to do to improve the survival rates. In these settings, also children that have completed therapy and have been cured for their cancers should have continued access to healthcare. Also, SIOP and CCI work together in advocacy actions in partnership. Let me address one of them, which I think is of critical interest for this audience. There is a lot we can do to prevent cancer in survivors and their families. SIOP and CCI are actively involved in activities to eliminate the use of tobacco, vaping, and other drugs delivered by smoking or other routes, which have devastating consequences in childhood cancer survivors and their families, exposing them to additional and preventable risk of cancer and other health conditions. In addition, our nutrition network actively works to promote healthy nutritional habits for our families to further reduce the incidence of gastrointestinal cancer. If you're attending this webinar, especially if you have been treating for childhood cancer, please do not start smoking, tobacco, or other drugs. And if you do, if you are already smoking, please consider quitting. In any case, join us to invite a family member or a friend to quit smoking. Unfortunately, I will be catching a flight at the moment of this webinar. I'm sorry for not being able to join you and celebrate this wonderful event with you in real time. But I thank you for attending, and I wish you a successful and inspiring and interactive webinar. Thank you very much again.
Thank you very much for joining us, everyone. We hope you'll join us in our future webinars, because these are very interesting discussions that are going to shape the future of survivorship around the globe. So thank you for attending, and we hope to see you soon. Bye, everyone.
Thank you so much.